We're going to go ahead and get started. Welcome to the last day of the conference. We're very glad to have you here for one of our last breakout sessions, so there are another set later. My name is Carly Wolf. I'm an analyst in the Office of Planning, Research, and Evaluation. Welcome both to those of you in the room and to those of you on the webcast, the live cast. The panel that we're about to go through right now is the Family Option Study, Short-Term Impacts, and Special Topics on the Special Service Needs of Homeless Families. As you've heard throughout this conference, the families at ACF and the families that you serve face many challenges, and housing is often one of them. I think often of housing crises as a severe manifestation of the poverty that we've been talking about this week. And I've been very pleased at the conference to hear housing mentioned across a number of the topics that we've been at. The Office of Family Assistance and the National Alliance to End Homelessness yesterday discussed TANF. We've heard the plenary discussion about extreme deprivation, and housing was mentioned there. You saw it in poster presentations. There's a youth homelessness discussion later this morning. So it's really been throughout the conference, and I think that that's nice to see as somebody that that thinks about these issues, that poverty and this is all very, very connected. For all we know about serving, though, individuals with chronic homelessness, and we still don't have perfect answers, but for all we know about chronic homelessness, we still have a lot to learn about homeless families and serving them. And so I think that this study that we're about to hear about is a really great opportunity to learn more about these families. And so I've been very happy to see this data and to see these presentations, and I've heard a lot about the Family Option Study, but I think that one of the things that this panel always does is to tell me something slightly different, and I'm always learning something, so I'm glad that we have these four presenters. So we have four presenters from Abt Associates. I'm going to give a quick introduction of them, give you a couple of logistics, and then turn it over to them to talk about. First, we're going to hear from Michelle Wood, who will speak about homeless families, interventions, and the design of the HUD study. Michelle is a principal associate at Abt Associates and the project director for the Family Option Study. Ms. Wood leads research projects in the areas of housing, homelessness, and economic self-sufficiency. She specializes in large random assignment evaluations. Second, Danny Gubits will speak about the short-term impact results of the study, which were released last summer. Danny is a principal associate at Abt Associates, where he conducts research in the area of economic self-sufficiency, housing, homelessness, and disability policy. He specializes in the design and analysis of random assignment evaluations. He holds a PhD in economics from Johns Hopkins, a master's of public affairs, and MBA degrees from UT Austin. Next, Sam Dastrup. We'll discuss the cost of the interventions from this study. Sam is an associate and scientist at Abt Associates, where he contributes to a variety of research projects, including leading the team in collecting and analyzing costs of homeless service providers in the Family Option Studies, as well as in other HHS, Department of Ed, and Department of Labor programs. He received a PhD in economics from the University of California, San Diego. Finally, Lauren Dunton will discuss the service needs of homeless families in the Family Option Study. Lauren is an associate at Abt Associates and currently directs the Homeless Families Research Briefs Project for HHS, in addition to leading projects on worker classification for labor and HUD's point-in-time count. She has conducted qualitative and quantitative data collection from a range of federal agencies and nonprofit clients. She has a BA from Connecticut College and an MA in public policy from the Johns Hopkins University. So this is our panel. I'm very excited to turn it over to them. A few quick logistics, again, if you want to come in so that we're close together. We've got a lot to cover, but we will have time for questions. We'll be monitoring the live stream, so for those of you who are online, please send in your questions. And then if you want the PowerPoint presentations, you can email RECS at impactint.com. That's RECS at IMPAQINT.com. Over to the panel.
Great, well, thank you very much, Carly. My name is Michelle Wood, and I'm from Abt Associates, and I'm going to talk a little bit about the design and implementation of the Family Option Study, and then I'll turn it over to my colleagues, Danny Gubits and Sam Dastrup, who will talk about the findings from the study. So the Family Option Study was sponsored by the U.S. Department of Housing and Urban Development, And since 2008, Abt Associates has been conducting the Family Options Study, and we're working in partnership with Vanderbilt University. And the study has also received additional support from the National Institutes of Child Health and Human Development. And that research support has supported some qualitative research that we've undertaken, and also data collection and research with children in the families in the study. So today we're going to talk to you about study findings that focus on about the first year and a half after study enrollment. The Family Option Study is continuing, and longer-term results will be coming out later this year, but for today we're going to focus on that first year and a half after enrollment. So the Family Option Study provides, it was undertaken, HUD decided to do this study to provide evidence about the effects of alternative housing and services interventions to determine which interventions work best for families who experience homelessness. The study uses an experimental design to carry out the research, and it took place in 12 communities across the U.S. And altogether, about 2,300 families, and within those families, there are about 5,400 children that are part of the research. Those families were randomly assigned to one of 3 active interventions or to a usual care group. This next slide just gives you a sense of the timeline and where we are with the study. Families enrolled over a 15-month period. The first families enrolled in the study in September of 2010, and enrollment ended in early 2012. We're talking today about short-term impacts, and those results were published by HUD in a report that was released July of last year. And again, that's about a year and a half after enrollment. A longer-term impacts report will be coming out later this year, and that will focus on findings and outcomes for families about 3 years after enrollment in the study. Okay, so I'm going to talk about the characteristics of the families and then give you a little bit of information about the interventions we studied and the research design. So altogether, national estimates show that about 150,000 families with children experience homelessness each year in the United States. And that number really has remained fairly stable over time. So what do we know about families who experience homelessness? So to our knowledge, the Family Options Study is the largest rigorous study of alternative interventions targeted to homeless families. So the study provides a really important opportunity to study a group of highly vulnerable families. All the families in the study were staying in emergency shelter at the time that they enrolled, and they had been in shelter for 7 or more days. And when we talk about the adult respondent or the family head of these 2,300 families, in most cases, this was a female adult in her late 20s. Somewhat surprisingly, the study also includes quite a number of 2-parent families. This was true for 23% of the families in the study, and that's despite the fact that many emergency shelters do not permit adult men. So for the families in the study, we'll talk a little bit about the children in those families. A single child was the most typical arrangement, but more than a quarter of the families were in shelter with 3 or more children. And like most families who become homeless, these families had young children. Half of the families in the study had at least one child under the age of 3 when they were randomly assigned, and 10% had an expecting mother. In approximately 1/4 of the families in the study, at least one child was separated from the family at the time of enrollment. And by that I mean a child was living with family or friends in foster care or some other situation. So this next slide just shows you the age distribution of the children in the families in the Family Options Study. The bar on the left is the age distribution for about 4,500 children who were with their families at the time of enrollment in shelter. The bar on the right is for about 900 children who were separated from their family at the time of enrollment. And it's important to remember, it's relatively common for homeless families to have a child separated while staying in shelter, just as a function of shelter rules and, ages of children and gender and things like that. So what we see here is that the children who were with their families tended to be young and younger compared to those who were separated. So as you see on the bar on the left, over half, and that's the red and the gray portion of the bar, of the children with their families were age 5 or younger. And the same was true for only 23% of the children who were separated. And similarly, for the children who were with their families in shelter, 12% were teenagers, while 31% of the children separated were teenagers. Again, then that probably reflects rules of shelter, for shelter stay. Okay, so let's take a look at some of the characteristics of these families. The life histories of the families in the study really show that it makes them vulnerable for housing instability. While homelessness is a rare event, almost 2/3 of the families in this study had been homeless before and for a median of 6 months in their lifetimes. The families also had been doubled up, and by doubled up I mean living with family or friends because they could not afford to pay the rent on their own. A large percentage, 85% of the families in the study, said that they had had that experience. And in the 5 years before the baseline survey or study entry, the typical family had spent 1 year in a doubled up situation. The families had also been exposed to violence. Nearly half of the adult respondents said that they had experienced domestic violence by a partner at some time in their adult life. And for many of the family heads, instability reached back into their own childhoods, with 16% reporting that they had been homeless as a child and 27% reporting that they had been in foster care, a group home, or an institution. So in addition to having low incomes, and at the time that they enrolled, the median family income, annual income for these families was about $7,400. Many of the families in the study appeared at baseline to have barriers to increasing their incomes through employment. Most of the families were not working at the time that they enrolled in the study, and more than half had not worked in the past 6 months. And more than 1/3 had no high school diploma or equivalent. So what this shows is that the families in the family options study are highly vulnerable and had significant barriers at the time that they enrolled in the study. So the objective of the study was to look at and examine different kinds of interventions that are intended to assist families experiencing homelessness. One of the important things about the family options study is it was not carried out as a demonstration. So that is, the study didn't analyze a specially designed model for assisting homeless families. Instead, the study examined program models that were already in existence in the communities. And this slide shows the 4 interventions that we looked at. The first is the permanent housing subsidy. And permanent housing subsidies were provided primarily through HUD's Housing Choice Voucher Program, a deep rental subsidy for housing in the private market. During the follow-up period that we're looking at, families who used this type of assistance did so for about 18 months. We abbreviate the permanent housing subsidy intervention as SUB throughout our presentation today and in our reports. The second intervention is community-based rapid rehousing, or CBRR. That is a temporary rental assistance, and it is also focused on housing in the private market. For families in the study, they typically received the community-based rapid rehousing for about 7 to 8 months. The next intervention is project-based transitional housing, which we refer to as PBTH. And PBTH provided time-limited housing. Typically, families receive this for about 12 months. And the housing is in facilities that are owned and operated by the transitional housing providers. This intervention unlike the permanent subsidy and the rapid rehousing, the PBTH intervention also provided social services that were provided in conjunction with the housing. So these three interventions, SUB, CBRR, and PBTH, are compared to usual care available in the community. We abbreviate usual care as UC, and it consisted of whatever types of housing and assistance families might access on their own. This map shows the location of the 12 communities. You can see that, that it includes a wide range of regions and different labor and housing markets. This slide shows the design of the study and how we carried it out. So to be included in the study, families had to have at least one child age 15 or younger with them at the time of enrollment. And as I said, families had to be staying in emergency shelter and had to have been in shelter for 7 or more days. Families who met these criteria were given the option of enrolling in the study, and families who wanted to enroll would then provide informed consent. After informed consent, families were randomly assigned to interventions that were available at the time and for which the family appeared to be eligible. So what this means is that not all 4 options were possible for all families who enrolled in the study. Random assignment offered families priority access to one of the 3 interventions, SUB, CBRR, or PBTH, or assignment to usual care. Now, families were not required to use the assigned project. Priority access gave families the freedom to pursue the assigned intervention or to pursue any other type of assistance on their own initiative. But what this design provides policymakers with is information and evidence about what sorts of assistance families use and the results of these different policy emphases. So to analyze the effects of the intervention, the research team analyzed the interventions in pairwise comparisons that contrast priority access to an active intervention to priority access to another intervention or usual care. And what we're going to focus on, what Danny and Sam are going to focus on today, are the 3 comparisons of the active interventions to usual care. So SUB compared to usual care, CBRR, and PBTH. Only families who were eligible for both of the interventions in a pairwise comparison and randomized to one of them are included in each comparison. So the only families who were part of the SUB versus UC comparison are families for whom it was possible to be randomly assigned to SUB or to all families it was possible to be assigned to usual care, but they were randomly assigned to one of them. And what this means is that each of the pairwise comparisons can be considered an experiment between 2 well-matched groups that only differ in the intervention to which they were assigned. The full report looks at all 6 of the pairwise comparisons that are possible. And I'm going to turn the presentation over to Danny now, who is going to talk about findings from the impact analysis.
Thank you, Michelle. I'm Danny Gubits from Abt Associates. The pointer.
It's right there. Just click the green.
Great. So I'm going to be presenting a lot of results to you this morning. First, I'm going to be presenting, and this is for the 3 impact comparisons that Michelle mentioned. So permanent housing subsidy, or SUB, versus usual care, community-based rapid rehousing, or CBRR, versus usual care, and project-based transitional housing, or PBTH, versus usual care. First, I'm going to show you the take-up of each of these groups, the take-up of their assigned interventions and of other programs that they weren't assigned to. And then I'm going to show you impacts on the key domain of housing stability. We're going to go through each of the 3 pairwise comparisons. And then I'm going to show you impacts on the other 4 key domains in the study, and those are family preservation, adult well-being, child well-being, and self-sufficiency. Then I'm going to pass the presentation over to Sam Dastrup, who's going to talk about the costs of these interventions, and then he's going to pass it right back to me for one final slide about key takeaway points. I wanted to take a few seconds to talk about the meaning of the impact estimates we're going to show you. So, for example, in the SUB versus UC comparison, the impact estimates, they reveal the average impact of offering the family priority access to the permanent housing subsidy relative to usual care. And it tests whether the priority access to an intervention, regardless of whether or not the families used the assigned intervention or used others instead. And this is going to be the same for the other two impact comparisons. So these are intention to treat impact estimates, or ITT impact estimates. So this shows you the program use for the families assigned to permanent housing subsidy, so the subgroup. And as you might expect, when families are offered priority access to one type of program, we see that that's the type of program that they use most frequently. Families use other types of programs too, but you'll see in each case it's the program that they've been offered priority access to that is the most used program. So here for the subgroup, 84% of the families offered a permanent housing subsidy took up the permanent housing subsidy. Some of the families in that group also took up other types of homeless and housing programs. So 13% used rapid rehousing, 6% used transitional housing, and then 3% used other permanent programs, and then 5% use no programs at all. These are not mutually exclusive because families can use more than one program, and we saw that, it's fairly frequent that families would use more than one type of program. And then here's the UC group. You can see that their use of programs is more even across these program types. They didn't have priority access to any type of program, and so some used permanent subsidies, some used rapid rehousing, some used transitional housing, some used more than one of these, and about a quarter didn't use any of these besides the emergency shelter from which they enrolled in the study. So I'm going to be showing you a fair number of impact slides. I'll go slower on this first one, kind of build it up, you'll see, and then all the other impact slides are done in the same way. So here are three key outcome measures in the housing stability domain, whether families have been homeless in the last 6 months before the 20-month follow-up survey, whether they had any emergency shelter stay in months 7 to 18 after random assignment, and then whether they had been doubled up with family or friends in the 6 months before the survey. You can see that for the usual care group, the proportions experiencing each of these were a quarter, a little bit more than a quarter for each of these outcomes. And then the red bars are the proportions in the subgroup, the families who had priority access to a permanent housing subsidy. And then the difference between these two bars is the impact estimate. So we see that priority access to the permanent housing subsidy reduced homelessness in the last 6 months by more than half. It reduced shelter stay in months 7 to 18 by almost half. And it reduced doubling up by more than half. So we say priority access to permanent housing subsidy results in large improvements in average housing stability over usual care. Here we see I'm moving on to the next impact comparison. This is CBRR, rapid rehousing versus usual care. And this shows the comparing the program use of those two groups. Again, we see that for the CBRR group, the program that they used most frequently was the rapid rehousing that they had priority access to. So 60% of those families used rapid rehousing. And then families in the CBRR group, you can see, used other types of programs. On the right of the slide, again, you see usual care families used a mix of different programs. And let me just note that the usual care families in each of these three impact comparisons are largely overlapping, but not exactly. And that's why the numbers here for the UC group differ a little bit from what I showed you before in the comparison with the subgroup. And so here, in terms of these housing stability outcomes, priority access to community-based rapid rehousing did not make a difference in the proportions experiencing any of these outcomes. And then here, this is the program use for the PBTH, project-based transitional housing versus usual care. Again, the most common type of program used for the PBTH group was the type of program that they were offered priority access to, and 54% of the PBTH families used transitional housing. You can see that 29% of the usual care families in this comparison also use transitional housing. And then when we look at the impacts on these housing stability outcomes, we detect some significant reductions for assignment to PBTH, about a quarter to a third reduction in the amount of homelessness in the last 6 months, again about a quarter to a third reduction in shelter stay in months 7 to 18, and we don't see a difference in doubling up in the last 6 months. So next, I'm going to turn to the other 4 outcome domains, and for each, I'm going to just do a little setup. I'll tell you a little bit about the outcome measures, the few outcome measures in that outcome domain. So here in family preservation, we've got 2 key measures. One is the proportion of families who have a separation at follow-up from a family who was with them at the time of study enrollment in the emergency shelter. And you can see that among the usual care families, 15% of the usual care families were separated from a family who had been with them at baseline, but had been separated at some point in the last 6 months before the survey from that child. Sure. It's the way it's defined here. It's always them, the family going somewhere else. Yeah.
Thank you.
Yeah. So, and then spouse partner separation. This is on a limited base. Of the, Michelle said that 23% of the families were 2-parent families in emergency shelter. From among that 23%, this is the proportion who were separated from the spouse or partner at follow-up, or sometime in the last 6 months before follow-up. And you can see that a little more than a third of those families did have a separation from spouse or partner at follow-up. So now again, we're looking at the sub versus UC comparison, and we detect a reduction in child separation from priority access to the permanent housing subsidy of more than a third. So it reduces it from 17% of families to 10% of families. And we don't find a difference in separation from spouse or partner. And then in the other 2 comparisons, we don't detect any significant differences in either of these measures. You can see that in the CBRR versus UC comparison, there is a 9 percentage point difference in spouse-partner separation, but this is on a small base and it's not statistically significant. Next domain is adult well-being, and here we've got 4 key measures. One, poor health, whether health in the last 30 days was poor or fair. You can see that's almost a third of the family heads in the usual care group. Self-reported alcohol dependence or drug abuse, you can see that's 14% of the family heads in the usual care group. Whether the family had experienced intimate partner violence in the last 6 months, and that's at 12% of the family heads in the usual care group. And then psychological distress, this is a standardized measure, so it's the UC average is by definition pegged at 0. And the goal here for all these interventions is to lower these values, lower these proportions. In the sub versus UC group, we detect a difference in 3 of these 4 outcomes. And you can see that priority access to the permanent housing subsidy reduces the proportion with self-reported alcohol or drug problems by 5 percentage points. So a little bit more than a quarter, again, between a quarter and a third. It reduces the proportion of family heads reporting intimate partner violence by more than half, from 12% to 5%. And it reduces psychological distress compared to the family heads in usual care. In the other 2 impact comparisons, CBRR versus usual care and PBTH versus usual care, we don't detect differences on any of these outcomes. Then in child well-being, we have 4 key measures. One, number of schools attended since study enrollment, so school mobility, number of absences in the last month from child care or school, whether the child has poor or fair health, that's reported by the parent, and behavior problems, again, reported by the parent. In the sub versus UC comparison, we detect impacts on the first two of these measures. So priority access to a permanent housing subsidy reduces the number of schools attended, and it reduces the number of absences. All these measures here, we don't have two bars here. These are all done in effect sizes because there's all different kinds of measures. We put them all on an effect size scale so you can kind of compare the magnitude of all of them all together. We don't find effects on either health of the child or behavior problems of the child, though. And then in these other two impact comparisons, the only significant impact we find is in the CBRR versus usual care comparison. We do detect a reduction in absences from the priority offer of rapid rehousing, but no other differences do we detect. And then here in our last outcome domain of self-sufficiency, we've got three key outcomes. One, work for pay, where there was any work for pay in the week before the survey. Again, that was at 20 months, about a year and a half after random assignment. Whether the family is food secure, and total annual income in the previous calendar year. So you can see that only about a third of the family heads in the usual care group were working for pay at the time at the follow-up survey. 65% were food secure, and income at this follow-up point was $9,000. Here in this domain, we've made the valances of these outcomes all going the same way. So here the intervention goal is actually higher values. In all the other previous domains, the goal was lower values. Here it's higher values. In the sub versus UC comparison, we see a reduction in the proportion of working for pay by the family heads of the subgroup by 6 percentage points, so about by a fifth, from 30% to 24%. And we see that in the other employment measures that we have, any employment since a random assignment. We see that there too. We see an increase in food security by 10 percentage points, from 64 to 74 percentage points. So the income that's the value of the permanent housing subsidy is adding to the total amount of resources that the family has, and they're able to use that increased amount of resources to increase their food security. We find no difference in annual income. Let me just point out that that income scale, it starts at 8,000. It doesn't start at 0. We started at 8,000 so that all the impact comparisons can be on the same scale, going from 8,000 to 11,000. But we don't detect a difference in income. For the CBRR versus usual care comparison for rapid rehousing, we detect no difference in working for pay. We do find an increase in food security of 6 percentage points, and we find an increase in annual income by about $1,100. This effect it's a little puzzling because you can see we don't see an effect in working for pay. We don't find an effect on the other employment measures or survey earnings measures that we look at. So the source of why the CBR families should have $1,100 more in annual income is unclear, but we do find this effect versus the usual care group. And then in the final impact comparison, project-based transitional housing versus usual care, we don't find differences in any of these three outcomes. Okay, I'm going to now turn it over to Sam Dastrup, who's going to talk about costs of interventions.
Thank you. So Danny has walked us through the important, really the key headline, important outcome findings of the family option study, and that's what we focus on. But knowing which of these interventions produces which different outcomes for families is only part of the information that is necessary to use the family option study for policy decisions. The different costs of the programs to which families are assigned is also an important input to policy decisions. And because, as Michelle outlined, these different types of programs have very different structures, some with very deep housing subsidies, some with wraparound services, others with shallower time-limited housing subsidies. The costs vary quite a bit, we find, across the different program types. Additionally, as Danny showed us, the use of one program changes the frequency of use of a different types of programs. So within the homeless services assistance program, so within all of the programs, there's a shift in use that changes the overall costs. So we measured and collected costs from the programs in the study to better understand the cost to the homeless assistance system of serving these families. And our goal was to collect comprehensive costs from the programs that assisted the study families. And we visited 45 emergency shelter programs, 24 project-based transitional housing programs, and 12 rapid rehousing programs, and collected administrative data from the 10 sites where the sub was offered. And to collect comprehensive data, we went on site and we met with the executive directors, with the financial officers of the housing and homeless assistance programs, and we reviewed their programs. Our primary source of information was audited expense statements, but we also walked through with program directors what a calendar of events would look like at a transitional housing program and the amount of time that case managers spent with families so that we could understand all of the inputs into the programs, what it was that families were receiving priority access to through the study. And here I've just had it's actually a partial list of the different inputs that we reviewed with these programs in a variety of buckets, from agency overhead to program services to direct client support, and really walked through what are all the staffing and materials and in-kind donations that go into providing these services that we're studying. We want to note that we include partner and in-kind costs, everything from preschool slots that were specifically reserved for children that were housed or receiving assistance from a particular type of program, to health clinics that came on site, to emergency shelters to provide physicals. In-kind examples include food and backpacks, toiletries, as well as activities, summer camps, arts and crafts time. We found a lot of different inputs across the different programs across the country. So once we'd gathered information on all these inputs and determined values and the costs of each of the inputs, we combined those for a program into a total annual cost from a fiscal year in which most of the study families that receive services would have received them. And we divided that by the number of families that the program would serve in the year, and divided by 12 to come up with our per family monthly program cost. So this is, in one sense, a measure of intensity of services provided by that program to families. Once we had that monthly family program cost, we developed a second measure, which was the cost of all program use during the follow-up period. And this is from the study family's perspective, where we took that use of programs that Danny showed you the differences in, and we multiplied a month of use in a particular program type by our per family monthly cost of that estimate. And so here we can see when families switch from using one type of program to another, how that affects the overall cost to the homeless assistance system of providing services to that family. Looking at what we found for per family monthly program costs, we see that these programs to which families were randomly assigned really did vary a lot in their costs and in their inputs. Starting on the far right with emergency shelter, we see that this was by far the most expensive of the program types. And this might be surprising. We think of emergency shelters as kind of a large room with kind of cots, and this is more true for single individual shelters, Whereas family shelters more often have a dedicated room for each family, or sometimes multiple rooms, maybe a common kitchen area. And so that increases the facility costs from what we might have in mind. And additionally, we found for families, there were a lot of supportive services, a lot of in-kind assistance, case management, donations, a lot of supportive services going to emergency shelter families in that initial instance of homelessness. Transitional housing, as was described, had a housing or shelter component where families, again, often had typically had a dedicated room or unit, and we actually found that these were often co-located. A transitional housing program would have some units that were shelter units and some units that were transitional housing units. And then there would be a wraparound services, often including health care and mental health counseling services, for example. Rapid rehousing was the least costly of the active interventions and of shelter. And this is because the housing or shelter subsidy, in the dark gray here, was shallow, and it typically was not income dependent. It was a fixed amount per month, and averaged with a little bit of housing search assistance, just under $900. And finally, permanent subsidy was wholly a housing assistance, typically a voucher with a voucher cost of around just under $1,200. So moving to our next cost concept, when we take these per family monthly costs and apply them to the program use that we see over the follow-up period between random assignment and the 20-month follow-up interview. Starting at families assigned to sub versus families who had sub available and were assigned to UC, we see that the change starting at the bottom with the red emergency shelter costs in these two bars, we see that sub decreased use of emergency shelter over the follow-up period and dramatically increased this lighter second from the top bar, dramatically increased the amount of use of permanent subsidy and the costs associated with that. And this decrease in emergency shelter use, along with some decrease in the use of other program types, that actually offset that increased subsidy cost over this initial follow-up period. So as a result, the cost of all different types of program use on average for families in this comparison over the entire follow-up period only differed by about $500 between, on average, families assigned to sub and families assigned to usual care. Looking at families assigned to CBRR versus families assigned to UC, we see that emergency shelter costs decrease, as do transitional housing costs for these families, and then as expected, rapid rehousing costs increase. But the decreases in emergency shelter costs and transitional housing costs are larger than the increase in rapid rehousing use. And so in the end, average cost to the homeless assistance system for serving families in assigned to community-based rapid rehousing was about 10% lower at $27,600 versus $30,600. Finally, assignment to, on the far right, assignment to project-based transitional housing versus usual care. We see emergency shelter costs decreased, but these are actually outweighed by an increase in transitional housing costs. And so the total cost to the homeless assistance system of serving these families is higher for families assigned to project-based transitional housing than it is for families assigned to usual care. Thank you.
Thanks, Sam. So just to sum up the results that we've presented, so providing an offer of permanent housing subsidy, the sub, it radiated benefits to all domains. We saw big differences in the housing stability domain, and then we saw differences in family preservation, adult well-being, child well-being, and self-sufficiency, although we did see a decrease in work effort of some amount in the self-sufficiency domain. Rapid rehousing, the CBRR group, it led to similar results in usual care and housing stability, and just some scattered effects. We saw one effect for child well-being, and we did see some self-sufficiency gains, an increase in food security and an increase in annual income. And as Sam just presented, it came at a lower cost. So rapid rehousing, all the programs used by those in the CBRR group was lower cost than all the programs used by the families in the usual care group. And then the service-intensive approach, transitional housing, project-based transitional housing, we saw some improvements in housing stability at the 20-month follow-up, but we didn't see effects on any of the other domains. Thank you. This is how to stay informed. Ann Fletcher is our project officer at HUD, and the 20-month report is on the HUD user website. And we look forward to your questions.
Okay. Good morning. My name is Lauren Dunton, and I'm here this morning to talk about some findings from additional research that we're doing for HHS using data from the Family Options Study. Too quick. There we go. Sorry, touchy. So HHS has special responsibilities for homeless families and youth under the Federal Interagency Plan for Ending Homelessness. In line with these responsibilities, ASPE and OPRE contracted with Abt to conduct additional research analysis of the Family Options Study data. This research takes advantage of the extensive data that Abt had already collected as part of the Family Options Study and involves almost 2,300 families with children in 12 communities across the country. While the study is not nationally representative, it has broad geographic coverage, and study families are similar in age and gender to parents, number and ages of children, and race and ethnicity to national representative samples of sheltered homeless. Therefore, it is a good sample for studying the experiences of families who have experienced an episode of homelessness. So far we've published one brief in the series, and it's entitled, Are Homeless Families Connected to the Social Safety Net? We're planning on producing 6 briefs in total. Some of the other brief topics include adolescent and young child well-being after experiencing family homelessness, patterns of homelessness among Hispanic families, family dynamics in homeless families, and adult well-being in homeless families. We may also complete additional briefs using the 36-month survey data. So first I'm going to discuss the published brief, which is related to families connected to the social safety net. There's often concern that homeless families do not have access to benefit programs that help improve their income, food security, and children's well-being. It's thought that it may be hard for homeless families to apply for benefits or keep them while experiencing or immediately after experiencing housing instability. So this brief uses descriptive analysis to explore how well homeless families are connected to various benefits and services. Programs we examined included TANF, publicly funded health insurance, including Medicaid and WIC, SNAP, SSI, SSDI, and early care and education programs, including Head Start. So we examined the rate at which study families received benefits while in shelter, as well as 20 months after their shelter stay. As you can see in the top 2 lines of the graph, their use of SNAP and publicly funded health insurance remained basically the same while in shelter and 20 months after. However, the rate at which families that experience homelessness received income from TANF cash assistance dropped by somewhat larger amounts than other benefits, from 41% to 33%, and that's the bottom line on the graph. It is difficult to pinpoint the reasons for this drop in TANF assistance, given that there are several reasons a family may leave the program, including lifetime limits, potential sanctions related to work or other requirements, Some families also began receiving TANF before experiencing an episode of homelessness and may have exhausted their eligibility for receipt of the benefit. Other families may be working now and no longer eligible. We then used Census's American Community Survey data to benchmark the rates of receipt of certain benefits to a broader population of families in deep poverty who were earning less than 50% of the federal poverty level. As seen in the slide, we were able to do this for SNAP, publicly funded health insurance, and TANF cash assistance. Our analysis shows that the rates of participation in SNAP, publicly funded health insurance, and TANF cash assistance are higher for study families in shelter at baseline than similar families who experience deep poverty in the same counties. When comparing the receipt of benefits site by site, the rates for TANF cash assistance vary by geography, which likely reflects the state or county policies related to TANF cash assistance. However, the rates in each of the study sites resemble the rates of families in deep poverty in the same counties. Generally, rates of participation in benefit programs were similar or higher for families experiencing homelessness compared to other families in deep poverty. This means that a lack of benefits likely does not distinguish homeless families from other families in deep poverty. It may seem surprising that we are focusing at all on SSI and SSDI for these family population, but self-reported rates of disability were high for these families. 10% of families reported receiving income from SSI, and 4% said they received SSDI. Income from disability benefits increased after an episode of homelessness, with SSI receipt rising to 13% and SSDI receipt to 7% 20 months later. This could be a result of families receiving assistance applying for the programs while they're in shelter and receiving assistance from case managers, or a result of the lengthy application process for both programs. Unfortunately, we didn't always have other families in deep poverty available as a benchmark, so in these instances, we used the best available comparison data for our analysis. Like other benefits, study families used early education and center-based child care at rates higher than the national benchmark of all children below 100% of the federal poverty level. 45% of children aged 3 in the study sample were enrolled in early education or center-based care, compared to 23% of children below the federal poverty level nationally, including states without study sites. For 4-year-olds, the rate of children enrolled is 63% compared to 42% of all children age 4 living below the federal poverty level nationally. Currently, we're working on another brief that will further explore the well-being of preschool-age children following an episode of homelessness. So when considering these findings, it seems that homeless families are able to access public benefits at rates equal to or greater than families in deep poverty in the same community. Lacking the supportive benefit programs does not seem to be a contributing factor that sets these families apart from other deeply poor families who remain in stable housing. We're also working on another brief that will examine whether differences exist in the participation rates of these families who experience homelessness based on their characteristics. So now I'm going to shift gears and talk about another brief that we're working on that looks at the experiences of adolescents in the study families. So while there's increasing awareness across the country around the number of unaccompanied youth experiencing homelessness, it is important to remember that most adolescents experience homelessness as part of a family. Adolescence is a key developmental period in which youth mature physically, mentally, socially, and psychologically. Stability and predictability in the home and school environments can help youth navigate these changes. When families become homeless or experience housing instability, adolescents' positive development may suffer, particularly if frequent moves also lead to changes in school. To better understand the experiences of homeless adolescents with their families, we completed descriptive analysis of 791 youth ages 10 to 17 who were members of the Family Option Study families during the time of the follow-up survey. Data is included from both the parent report portion of the survey as well as a separate survey that was administered to the adolescents. We then used other national data to better understand how these adolescents fared compared to adolescents in families with income below the federal poverty level. In some instances, this comparison was not possible, so we looked at other adolescents across all incomes. The findings related to adolescents that I'm going to be presenting momentarily are preliminary. HHS has not yet formally published the brief looking at adolescent well-being, though we anticipate it being released in the coming weeks. 20 months after their stay in shelter, many adolescents continued to experience housing instability. 23% of adolescents in the study reported moving at least one time, and 5% reported moving 3 or more times in the past 6 months. The 35% average mobility rate over 6 months experienced by study families is almost 2 times the national average annual mobility rate, experienced by families below the federal poverty level, which is 14.5%. Many adolescents in the study also experience living in overcrowded housing, and overcrowded housing conditions can make it difficult for adolescents to do homework or have adequate privacy, and generally have enough support during a very difficult transition time in their life. 20 months after experiencing homelessness, adolescents also often lived in overcrowded housing, with 55% living in overcrowded dwellings, which are defined as having more than one person per room in a dwelling unit, and 35% experienced severe overcrowding, which is defined as 1.5 persons per room. These rates of overcrowding, again, are much higher than the rate of overcrowding experienced by very low-income renter households with children, which is measured at about 15%. Changing schools is often shown to be associated with reduced academic performance. On average, adolescents attended 2 schools in the 20 months following the stay in shelter with their families. During the same period, study adolescents were much more likely to report having changed schools, been absent from school, been absent frequently, and exhibited problem behaviors in school than all adolescents nationally. On average, adolescents in the Family Option Study attended 2 schools following their stay in shelter. 70% changed schools at least once, and 23% changed schools 2 or more times. As shown in the graph, school mobility is high for study families at 70%, and compared to national estimates for all adolescents across all income levels, which is 21% of 8th graders nationally and 10% of 12th graders. Oh, there we go. In the 20 months after staying in shelter with their families, adolescents were much more likely to have changed schools, been absent from schools frequently, and exhibited problem behavior than their peers nationally at all income levels. Adolescents in the study reported being absent an average of 2.5 days in the last month, and the majority, 58%, had 1 absence in the past month, and 30% had more than 3 absences. Higher rates of absences for previous homeless adolescents suggest that recent homelessness is associated with low rates of perfect attendance and high rates of chronic school absences, which is defined as 3 or more absences within a 1-month period. I would like to quickly highlight a couple of other findings regarding the experiences of adolescents in homeless families. Prior research has shown that school mobility can lead to academic and behavior problems. Adolescents who experience a shelter stay within the family exhibit less positive behavior compared with other adolescents of the same age and gender across all income levels. Finally, reported substance use was extremely low among adolescents in the study. National rates of substance use are 3 to 11 times higher than in the study sample. The reasons for this contrast on substance use rates are unclear. The differences could be attributed to the fact that survey questions were likely administered differently, which could have impacted youth responses. Also, the adolescents in the study likely have less expendable income with which to purchase alcohol, tobacco, or other drugs. Okay, so as I mentioned earlier, we have 1 brief that has been published in the series, and that is available on at the link provided on the slide. And we anticipate the rest of the briefs being available through the remainder of 2016 and into 2017, and they also will be posted on the HHS website. So thanks from all of us on the panel, and I'm going to turn it back over to Carly.
Great. Let's give everybody. This is always insightful to me to hear about the family options study. I've heard several of you and others discuss this many times, and there's always some new nugget that I'm thinking about and thinking through. But if we have other questions from the group, I welcome them, or I will ask some of my own questions. My first question is actually more logistical, I guess, and just what should we expect from the report on the longer term, the 36-month outcomes? Will it be similar outcomes that you're reporting on, and what might we see from that?
Sure. Yes, the 36 months analysis basically looks at the same pairwise comparisons and basically the same outcome domains and pretty much the same findings. So what it will provide is a picture of the effects of these interventions over a longer period, about 3 years after enrollment.
Great, and we also look forward to the other HHS briefs, of course, and you mentioned what those might be. Do we have a question coming from our audience?
Good morning. I just wanted to hear more about the measures that you use to measure psychological distress in parent well-being. I'm interested in hearing what the measures are, your strategies for collecting the data, if Abt went in and did the was it online, and things like that.
Sure, thank you. The psychological distress measure was the Kessler-6 psychological distress measure, so a 6-item scale that's been used in national surveys, developed for national surveys. And I think you asked about the data collection and
The data collection,
Yeah.
your strategy, and then also, did you collect data at one point? Did you do it over time?
Yeah,
And maybe, and also one other, and how it aligned with the actual intervention itself. So, did you collect the stress data right 3 months after they went into being housed, and so on and so forth?
Thanks, and I'll talk about that all together since it lends itself to that. So in these 12 communities, the families were enrolled into the study by an on-site interviewer. So some staff from the study were in these 12 communities, and they would talk to the families in the shelter and tell them about the study and give them informed consent and do administer a baseline survey and then do random assignments. So they met with the families right then at the point of study enrollment. And then the idea, what we tried to do to increase our response rates was a high-touch strategy. So that was a baseline, and then basically every 3 months we were having some kind of outreach to the family. So at 3 months after random assignment, there would be either a phone call or a postcard. And then at 6 months after random assignment, so then this was at both 6 and 12 months, we did a short survey, like a 10, 15-minute survey. And there we just asked, where are you living right now? Who's with the family? What are the family members who are with you right now? You know, are all the people who are with you when you enrolled in the study, are they still with you? Is anyone new with you? And then we also asked, what programs have you used? So at 6 months, we were already asking, what program are you using? Are you using any program right now? And what programs have you used in the last 6 months? And then, so then again, at 9 months, there was some quick touch, a phone call or a postcard. At 12 months, there was another one of these 10 or 15-minute surveys. And then at 20 months, there was a big survey, and that was maybe an hour-long survey of the parent, and we also did the child data collection. We did the surveys that Lauren talked about. We did surveys with older children, and we did a few assessments with younger children, ages I think 3 to 8. Yeah, all the assessments were done in person. So, and actually most of that 20-month data collection was done in person.
Some was done by phone, because there was a fair amount of mobility.
Right.
Some families had moved out of the community.
Out of the sites.
And we would try to do the survey by phone if we couldn't.
That's right. If they had moved out of the community, the direct child assessments weren't possible. And then after 20, and then that was the 20-month results that we've presented. The study continued at 27, about at 27 months, there was another one of those 10 or 15-minute surveys. Again, we were asked who's with the family and what programs have you used. And then at about 36 months, we again had another big data collection effort where it was the hour-long survey with the family head and these direct child assessments and a survey with the adolescents. So that's a lot of different ways. Some of the information we've got, at 5 different time points, or 6, some information 6 points if you include baseline. Yeah.
Hi, thanks so much for your presentations. I have 2 questions.
Yes.
The first is I was wondering if you did any implementation research to understand why the groups that were given priority for a certain program or service, why some of them didn't take it up. And the second question is, in the final presentation, I was wondering if you could explain why sometimes the comparison group was 50% below the poverty level and sometimes it was 100%.
Okay, so I'll answer the first part, right? And then the second part's for Lauren. Excuse me, I'm blank. The first part again was?
Why didn't
And
Yes.
if you talk to families about why they might not have taken up what they were offered priority
Yes.
for.
So we have some information on that, in the survey just for the project-based transitional housing. We have some survey information on that, but most of our information on that is actually some qualitative data that was carried out by Beth Shin at Vanderbilt University, who's a co-PI in the study, and some of her colleagues at Vanderbilt University. And so Michelle talked about some of that qualitative data collection. And so let me just kind of briefly summarize. So there was lower take-up for the rapid rehousing and transitional housing than there was for the permanent housing subsidy. In rapid rehousing, I think the quick answer is that both the time limited, that it was just going to be a few months of assistance, so maybe it wasn't worth the effort to kind of go through that and get that. And then also it was somewhat a little bit shallower. I mean, it was close to the amount of a permanent housing subsidy, but on a month basis, it was a little bit shallower. So I think there was a sense that because it was a temporary program, it maybe wasn't worth the effort, and so the take-up was a little bit lower there.
I think uncertainty was something families also mentioned in the qualitative about the rapid rehousing, that every 3 months families have to recertify, and so some families in the qualitative interviews expressed some concern over the uncertainty of how long the assistance would last.
Mm-hmm. And then in the transitional housing, I mean, there was some kind of very interesting qualitative information that came from that, and some of the reasons given for lower take-up of transitional housing, one was because these are project-based, so they're in facilities that are owned by service providers. Something that was mentioned was just neighborhoods. Sometimes people didn't want to live in the neighborhoods where those facilities were, which is different from a voucher where the family gets to choose themselves where they want to live. And then, as you might expect, all of us, it can be a bit onerous to live in a facility underneath someone else's rules, and so some of the family heads mentioned that, and they didn't necessarily like the idea of that, and even some of the families who did use transitional housing mentioned that they weren't so keen on that, to where rules about when to be in and when they can go out and what time to go to sleep, and just the shared nature of the space. Sometimes, again, families would prefer to have their own space in their own apartment. So those were the reasons. Yep.
Lauren? Okay. Is this on?
They should turn it on.
It's on? Okay, sorry. Simple answer is really, it was just to your question about why sometimes use data at 50% of the poverty level and sometimes 100%. It was what was available for comparison. So in some cases, we were able to find 50% data and sometimes 100%. So it was really just to get as accurate a comparison as we could, but we had to use what data was already in existence for benchmark.
Okay, thank you.
Do we have other questions from the audience? I was wondering, oh, yes, I'm sorry.
I don't want to hold
Yes,
it up,
please.
but I can ask another. So as far as your unit level of analysis, I'm noticing that you used children well-being and the parent well-being, but then there was no focus on kind of this holistic family functioning, family cohesion, nothing like that. And so I'm in the agency that I work for, we're always kind of trying to grapple with this on what level of analysis do we want to focus, and how in sharing the information do we then relate that information to our stakeholders. Is there a reason why you chose not to do any measurement at the family unit level?
You mean kind of combining these outcomes
Yeah, I'm not
from
sure that
across
you would
domains?
I don't know if you'd combine those domains, or if you'd measure something that's kind of designed to capture the family, like cohesion and things like that.
So we have talked about kind of omnibus measures. That's something that our principal investigators have talked about. I think because we have in the report, you'll see there's 73 outcomes across these 5 domains, and we were kind of just at some point just trying to kind of keep it more simple. The housing stability domain, which is kind of the key domain in the study, all those outcomes are at the family level.
Can I? One of the findings that really strikes me is the intimate partner violence finding, that decreases by about half for subfamilies. And then there's the family preservation outcomes as well, which look at, do children stay with the families, and do couples stay together? So I think some of those are getting, I think maybe a little bit at what you're talking about. Among those many outcomes, that some do kind of look at the family composition and interactions within the family.
All right, maybe I will take time to ask one more question if there's nobody else. I feel like I should know this, having looked at the report and heard many discussions. I was struck by the number of 2-parent families in the study, and I wondered if you broke out at all outcomes between parents in single-parent families and 2-parent families, to see if there were differentiated outcomes in those families.
That's a great question. The answer is no, that is not something that we've done yet. Because there were going to be really just so many different types of subgroups and types of characteristics
absolutely.
to define subgroups, we purposely kept it very narrow. We had in our kind of pre-specified analysis plan, we just looked at 2 indices, a challenge index and an instability index, and those were the only kind of subgroups moderation that we looked at. But that's
And we didn't find differential effects.
we did not find differential effects for any types of families.
Okay.
So and we haven't gone looking for any of the many characteristics that we could, but that's actually a very obvious one that would be good to look at, to use for this data. What about the families that are starting off with 2 parents? Yeah.
I think it is one of the challenges and great opportunities in this study that you've been talking about, that there are so many different things that you've measured, but going and searching for things to look for impact is also not a wise way to do research, and to think about that and what that means going forward, but also to think about what might come from future analyses of this data.
Yeah, I'll just put a little plug for HUD, which is all this enormous data collection effort that HUD has sponsored. It will be available to researchers. There will be restricted access data, so almost all this data will be available to researchers through HUD.
Yeah, which was wonderful. Any final questions? We might have time for one more. If not, I will let people come forward if they have questions for the panel afterwards. Let's give a big round of applause to our presenters.